Hi, this is Dave Jensen, and today we'll be covering the two-tray method for indirect bonding. This method is specific for the use of 3D printed casts. The things that you're going to need are your brackets, composite, and items to place your brackets onto each of these casts. So when bonding brackets to 3D printed models, you're going to want to make sure that you have any undercuts blocked off with a blockout resin. When bonding to models, I'll use cotton pickups for speed of picking up the brackets and placing them. Another helpful tip will be to use about half as much composite as you would normally use when bonding. This will allow the brackets to debond from the model when you need them to break off into the trays, as well as not having to worry about sandblasting off as much on your finishing stages. So I'll continue to put the rest of the composite on each of the brackets and bond ideally, using really one instrument at the same time, wick stick to get the heights, and then thoroughly curing. The resin is not as translucent as teeth are, so it's going to be important that you cure from all directions very thoroughly. You're going to repeat this same process with the upper arch. And thoroughly cure. The first tray made on the model will be the inner tray. This will be done using a 1mm mouthguard material. We use a Ministar machine here. When placing the model on the plate, be sure to have the occlusal surfaces pointing up and the anterior of the mouth pointing to the far side of the hinge. Once the suckdown's complete, make a cut or score about 3mm apical to the gingival zenith of each of the teeth. This can be done with a buffalo knife or another sharp instrument in order to displace the rest of the soft material from the model. Then take the model and the mouthguard material and thoroughly spray it with a cooking spray. Palm or canola oil works just fine. This will keep the outer tray from sticking to the inner tray when you put it on the Ministar machine here. So we use an 030 Essix material. You're going to remove the cover plate and add some of the beads here. This is going to help prevent undercutting from the more rigid 030 Essix material onto your model. I'll embed about 2mm apical to the gingival zenith. This will allow the tray to fully cover each portion, including the gingival wings. When you remove the model from the Ministar machine, you'll see that both of the trays are essentially stuck together. Know that there is an oil barrier between the two. And in order to get the trays off with the brackets holding into the trays, remember that the brackets are bonded to the teeth. You're going to need to displace the brackets from the teeth. And I use a small number 9 instrument and slide it underneath both trays and debond the brackets from the surface of the model by just pressing firmly, occlusally, on the base of the bracket. This can be done just by maybe a little bit of a twist, but again, we're using a small amount of composite just to hold them in place, so a little bit of pressure should be able to debond these from the model, and it will essentially debond them into the soft tray. So then, removing the model from the soft and hard trays together, I'll usually go from the distal aspect, use that number 9 or maybe a buffalo knife to remove it. Now, if some brackets don't debond, you think you did it, but it stayed bonded to the model, you can just debond that into the soft tray. It doesn't matter if the soft tray separates from the hard tray now, because you still need to wash them in the next step. At this point, The trays will be slippery because you do have that oil barrier there. I just put them back together for ease of use, also to make sure that the model is, or that the tray is retentive. We'll then repeat that with the other arch. So now when I'm cutting the outer tray, I'm going to cut a little apical to the gingival wings and hooks. So about 2 millimeters above where the gingival aspect of the wings would be. Just because this will be trimmed in the future, this is really to get most of the other tray material off, so you just have the arch, easier to deal with. Again, you'll also want to extend your hard tray to about the distal marginal ridge if you are bonding the terminal tooth, or one tooth distal to the last bonded tooth. In this case, we're bonding 6s, so I've extended to the distal occlusal surface of the 7s. But if you're bonding 7s, then extend to the distal marginal ridge of the 7. Now you'll want to take each of the trays, have them separated, a drop or two of dish soap and water. Make sure you rinse thoroughly to remove the oil barrier that you place between the two models. So now moving to finishing. These trays will be a little rough and they'll also be a little long. So first, the outer tray should be cut immediately apical to the gingival wings. So you'll be cutting off the portion where the hooks would pass. We'll show this in a moment for you. The inner tray should be cut level to the gingival zenith. We'll also show this to you on the cast in just a moment. So again, the inner tray should be sitting cut at the incisal, or at the gingival aspect of the tooth. And on the lingual, I usually leave about 2 or 3 millimeters. The outer tray, which sits on top, should be cut right at the gingival aspect of the wings. I also find that little retention should be had from the outer tray to the inner tray. So you see the two different trays, one sitting at the gingival zenith, the other one sitting at the gingival aspect of the wings. Finally, I'll smooth the edges of the outer tray only. The inner tray is soft, so there's really no need for that. But the outer tray is really more for just patient comfort if there's any sharp parts from when you've cut the tray. Complete the same on the other arch. Now, to make sure that we don't have any more composite remaining on any of the brackets, I'll take 90 micron aluminum oxide and sandblast each of the internal pads of each bracket. Again, you should make sure that there's no composite on any of the bracket pads. This will decrease the bond strength. Complete this for both of the arches. There will be some aluminum oxide remaining on those trays. They'll look dirty. Wash them again with just a drop or two of soap in some water. And I'll also take a large pipe cleaner brush and scrub on the intaglio surface of each of the trays. It may feel like you're brushing too firm, but know that these in 1 millimeter mouthguard material should be firmly embedded, so you can really scrub to make sure that these are nice and clean. When you're finished with that, make sure you rinse thoroughly. They should be relatively clear, and sterilize. Dry thoroughly, mark your midlines for clinical use, and store in a black or an orange case.